Welcome to the Uni SQ Bachelor of Midwifery Continuity of Care portfolio. This short video is just to help provide some guidance around the documentation of COCE experiences that the students will be having. This is quite a large document, so we'll go through this quite quickly. There's no need for me to read every part of this. I will point out that reflection on practice is highly respected as a way to increase depth of learning and understanding. So for the purposes of our COCEs, we use Page's 5 steps of understanding, and students are expected to become quite knowledgeable about these 5 steps to be able to reflect on practice. Every single woman is individual, every single pregnancy is different, and so it's really important to understand what is going to be important to this woman and how we can support her throughout this pregnancy journey. So for all COC write-ups, these 5 steps need to be addressed, and you can find more information in your portfolio there. There are quite a few student responsibilities when attending COCE experiences. It's important to understand all of these responsibilities. It's also important for preceptors to be aware of these as well, to ensure that students maintain professional practice at all time and are practicing within their student scope. It is important to maintain confidentiality throughout. On all documentation, the only one that will have any kind of identifying feature will be the consent form with the woman's name and phone number, and a copy of that consent form is given to the woman. It is uploaded to InPlace and it is put into the woman's hospital file or the chart, however that is recorded on that legal documentation. As NMAC requires, attending COCE experiences, there has to be a minimum of 4 antenatal visits, attendance at the labour and birth, and a minimum of 2 postnatal visits. If those antenatal and postnatal visits are not met, that 4 and 2 numbers, then the COCE cannot be counted as a completed COCE. You can still submit the hours and the episodes of care, but this will not count as a completed continuity experience. As per NMAC requirements, you need to attend a majority of the births, which means at least 6 of the labour and births, to act as the primary accoucheur. So in each midwifery practice course, we do have a number of COCEs to be completed in each one. For 1199, you need to complete 2. For 1299, you need to complete 2. And 2599 and 2699, you need to complete 3 each. So for a student studying full-time, in their first year of study, they will need to complete a minimum of 4 COCEs. In their second year of study, they need to complete a minimum of 6 COCEs. And MAC requires that a majority needs to be done in the second half of the study. So there still needs to be 6 in the second year. And then all of these documents need to be submitted all in a single file so that they can be considered all together. So the completed record will include the information letter given to the woman, the signed consent form, the documented record of the experiences, which is also including Page's 5 steps, copy of the student's evaluation of the experience, any other documents associated with the COCE experience. They just need the unique ID code for that woman, which will in general be an initial, and then a cumulative record needs to be completed as well. So this is just an information letter which needs to be given to the woman, just so that she understands the process of the continuity experience and the fact that she is able to withdraw from the partnership at any time. So women need to know that even if they sign up to this, this is not a life contract, and if they decide at any time that they no longer would like a student as part of their journey, then they can withdraw that. This is just the consent form. Again, this is the only document that will have a woman's full name on it. And this just needs to be signed by a facilitator or an educator just as a witness to say that, yes, this woman has actually consented to this process. This is the woman's evaluation of continuity of care experience. Students can print this out and can give it to the women along with a stamped self-addressed or envelope that they can pop in the mail to send back to Uni SQ. This means that women can be completely honest about their experience and not feel as though they're going to upset or offend anyone if the feedback that they give is not amazing. So that's their evaluation. There are 10 templates in here for the continuity of care records. If a student does any more than 10, they can just reprint and just call it number 11, number 12, so on. These documents are provided to students in a Word format so that they can just continuously document in this as the partnership develops and they see the women more and more, they'll be documenting each episode of care with them, and then they can document the labour. So this is a dynamic document that, you know, can take 2 to 6 months to complete. So we do provide that in a Word document, and there's all the templates. Cumulative record there just at the end of each year, just so that we can keep an overall track of where students are up to with their COCE completions. There is some guideline in here about how to document in the continuity of care experience. That's not necessary for us to go into this now, but if there are any questions about how to complete these, by all means reach out and we can help to walk you through that in a little bit more detail. Okay. It is important to verify all of the times, all of the episodes of care that you have with women. So her ID, again, probably her initials, student name and signature, and then a date in each type of visit. So this is where you'll put your date in and whether this is an antenatal visit, antenatal classes, perhaps it's a morphology scan, perhaps it's a dietitian, whatever is required, and then a name and signature from the healthcare professional, because we do know that midwives are not 100% responsible for care for women, that there can be quite a few other healthcare professionals involved, and they can verify that you have attended an episode of care as well. Students also need to fill out their own evaluation of the continuity of care experience, and this needs to be completed for each continuity of care experience that is uploaded. So a complete documentation of the COCE will include this as well. Again, if there are any other questions about how to complete or fill out any of these experiences, please reach out to any of the Uni SQ midwifery team. Thank you.